everyone, my name is Krishy Janine Ramos and I'm a first year physical therapy student, and in this video, I'm going to take you through the basics of these cranial nerves and help you to understand what the cranial nerves are, as well as a few different ways to help you remember which nerve is which. Alright, so let's talk about what are our cranial nerves and so essentially what cranial nerves are. As the name implies, the cranial nerves come up of the brain and brainstem. And when it comes to these cranial nerves, there's actually 12 different cranial nerves that we have, and each one of these cranial nerves is going to be paired and present on both sides of the body. So now we use Roman numerals to number these, and we basically number them based on where they emerge from the brain. So in the brainstem, when looking at it front to back, so in order to view these cranial nerves, you want to be viewing the inferior surface of the brain, and which is what we have going on here. And essentially, what these cranial nerves are doing is that they are relaying information to and from various parts of the body, which are primarily going to be in the head and the neck, and then having the communication with the brain. Now, in order for this relay of information to take place, we have two different types of neurons that we're going to see with these cranial nerves. And these are neurons that we call afferent and efferent. Now, the afferent neurons are sensory neurons that are carrying signals from various sensory stimuli back towards the brain, while the efferent neurons are motor neurons that are going to be carrying signals away from the brain to either have some effect on muscle or some other target cells, and you'll see here in a minute when we go through and talk about these different cranial nerves. But some of these cranial nerves are going to be efferent and some of them are going to be efferent. And some of them are actually going to be a combination of both. And so, with that said, let's actually move on and talk about the cranial nerves. Alright, so the first nerve that we're going to begin with is, as you can figure, cranial nerve 1, and this is going to be our olfactory nerve, and this cranial nerve is essentially, and now this cranial nerve is also the first of only two nerves that actually originate from our cerebrum, and it travels through the ethmoid bone and lays upon the cribriform plate. And this one is essentially a sensory neuron that is responsible for something that we call olfaction, or what we commonly known as sense of smell. Alright, the next cranial nerves that we're going to talk about is the cranial nerve 2, which is the optic nerve, and these are also sensory nerves which receive signals from the retina and brings this vision info to the brain. So for the next cranial nerve, which is the cranial nerve 3, or this is what we call the oculomotor nerve, and this particular nerve originates in the midbrain, and this one is actually strictly a motor neuron, and this nerve here actually has a few different functions, and it supplies most of the muscles of the eyeballs, and these muscles are the inferior oblique, superior rectus, inferior rectus, and the medial rectus. Oculomotor nerve plays a primary role in eye movement, but it also plays a role in some autonomic functions such as our eyelid elevation, our pupillary constriction, as well as the reshaping of the eye and the lens itself, something we call lens accommodation. And after the cranial nerve, we have the cranial nerve 4, which is what we call the trochlear nerve, and this nerve also originates in the midbrain, and it is also a motor neuron and plays a key role in our eye movement. And the trochlear nerve also supplies one of the eyeball muscles, which is the superior oblique muscle. What are the roles and responsibilities of physical therapists in this topic? So, a physical therapist for neuropathies, diagnosis, or symptoms can address your movement deficits. They will do a body evaluation during first visit to create a personalized treatment plan for your needs. And your therapist will include a warm-up with general muscle activation and strengthening exercises, as well as walk you through gait and balance exercises to help regain some of your mobility. They will also help you activate muscles in areas where you have lost sensation, so you can maintain the health of the muscle tissue even while dealing with numbness, tingling, and or pain. So how does this subject will help me in the near future when I became a PTRP? So, neuroanatomy is the study of the anatomical organization of the brain, and it is also considered a branch of neuroscience, which deals with the study of the gross structure of the brain and the nervous system. And in clinical practice, it is important to understand how the nervous system develops, how specific regions function and communicate with each other, and how these connections give rise to our motor acts, and how experience or pathology can alter these functions. And this knowledge will allow me to provide appropriate care for my future patients as a future PTRP with nervous system dysfunction.
Good day everyone, I am Maria Vasquez, taking Bachelor of Science in Occupational Therapy at University of Perpetual Health System DALTA. I'm going to briefly discuss the importance, parts, and functions of cranial nerve 5, 6, 7, and 8. And I'm going to add the role and responsibilities of OTs in this topic, as well as the help of this subject on us in the near future. First one is the cranial nerve 5, also known as the trigeminal nerve. It is located at the middle of the ventrolateral of the pons. It is also the largest cranial nerve and has both sensory and motor function. It is responsible for sending pain, touch, and temperature sensation from your face to your brain. Isa sa mga lesion niya is inability to chew. The next cranial nerve is cranial nerve number 6, also known as the abducens nerve. It is located at the junction of pons and medulla. It is one of the nerves responsible for the extraocular motor function of the eye, along with the oculomotor nerve, which is the CN3 or the cranial nerve number 3, and the trochlear nerve or the CN4. Lesion naman ito is abducens nerve palsy. The third one is the cranial nerve number 7 or the facial nerve, and it is also located at the junction of pons and medulla. It carries nerve fibers that control facial movement and expression. It provides motor innervation of facial muscle that are responsible for facial expression, parasympathetic innervation of the glands of the oral cavity and the lacrimal gland. Ang lesion nito is yung weakness of facial muscle or the Bell's palsy. Yung last cranial nerve sa part ko is the cranial nerve 8, which is also known as the vestibulocochlear nerve. It is located at the pontine and cerebellar junction. It brings sound and information about one's position and movement in space into the brain. The vestibular nerve handles balance and equilibrium, while the cochlear nerve is responsible for hearing. Ang lesion naman nito is hearing acuity and balance. The role and responsibilities of an OT is to assist the patient and know their history as well as the occupational profile, and to determine the problem in which part of the body is affected and check if there are cranial nerve involved in the problem. OT knows how to do or what to do and kung anong frame of reference ang pipiliin namin nakatugma dun sa problema ng patient. Meron kasing cranial nerve na minsan nagkakaproblema sa mukha, katulad ng Bell's palsy. Ang affected na cranial nerve dun is yung cranial nerve 7, which is the facial nerve. Ang gagawin ng OT is educate ka and tell you about how to protect your face and your eye. Tapos, pakita sa'yo on how to manage your daily life function while you have the Bell's palsy or the facial paralysis. OT can help you by guiding you and telling you about what to do or what you can do ng patient. A-assist and gagawa ng plan and daily activities para ma-improve mo or para matulungan ka ng OTs para maging maayos yung problema ng patient. Marami na i-help yung subject na to, neuroanatomy, sa amin kasi it is by visualizing normal structure and function that we will be able to recognize abnormal clinical manifestation katulad ng mga lesion nangyayari sa mga pag nadadamage yung isang cranial nerve o iba't ibang neurological problem na nangyayari. This subject will serve as the guide in our journey by knowing the responsibilities of the neurological parts like these cranial nerves and knowing what would happen if one of them are damaged. Marami din kami natutunan sa parts and function ng utak at kung ano mga responsibilidad nila sa katawan ng tao. Pati na rin kung paano sila mag-function at kung ano nagiging sanhi at epekto nito pag nasira.
Good day everyone, my name is Sean Cortado and today I'm going to discuss about the cranial nerves number 9, 10, 11, 12. So for the cranial nerve number 9, we have the glossopharyngeal nerve, and it is located at the medulla oblongata posterior to the olive, and it exits to the jugular foramen. Its function is to assist the stylopharyngeus muscle and swallowing parotid salivary gland. Its action is motor and sensory. It supplies the posterior 1/3 of your tongue, and its motor component is responsible to all the muscles to enable you to correctly swallow. Then we have the cranial nerve number 10, which is the vagus nerve. It is located to the medulla oblongata, posterior to the olive, and it exits to the jugular foramen. Its function is motor and sensory. It is responsible for your voice, swallowing, and placement of your uvula. Then we have the cranial nerve number 11, which is the accessory nerve. It is located at the medulla oblongata, posterior to the olive. Then it exits to the jugular foramen, and its function is to control the muscles of your neck, such as the trapezius and sternomastoid muscle. Then, the last one, we have the cranial nerve number 12, which is the hypoglossal nerve. It is located at the medulla oblongata, anterior to the olive. Then it exits at the hypoglossal canal, and its function is to innervate your tongue muscles. So what are the roles and responsibilities of an occupational therapist to the cranial nerves? So your cranial nerves plays a role in controlling your sensation and your motor skills. Your cranial nerves affects many function and sensation. As a result, different cranial nerve disorder have different symptoms. A cranial nerve disorder might affect your balance, facial expression, hearing, sense of smell, swallowing, taste, and vision. So the goal of the rehabilitative care is to improve or prevent the worsening of the patient's condition. The occupational therapy focuses on helping you perform daily tasks more easily. This type of therapy focuses on improving your fine and gross motor skills so you can carry out specific day-to-day activities. The occupational therapist will also focus on making your home or school environment more optimal for your everyday life. So how does this subject will help you in the near future when you became a OTRP? So neuroanatomy involves the study of the nervous system structure at both the microscopic and gross level, as well as its development. It also introduces you to some basic research techniques used to explore brain structures. So the occupational therapies aim to improve the health and participation of clients through engagement in occupation, which include activities of daily living, instrumental activities, rest, education, work, play, leisure, and social participation. So the occupational therapy assesses client factors such as performance skills and performance patterns, activity demands, and environmental contextual factors to understand the underlying factors that support and hinder successful engagement in occupations. An occupational therapist who works with clients with neurological impairments is likely to have an experience of working with a broad range of conditions that falls under the two distinct headings, which are the acquired brain injury and progressive conditions.
The spinal cord is part of the central nervous system, and this long structure runs down the center of our back, and it mediates messages between the brain and the peripheral nerves. The spinal cord is primarily composed of nerves which are organized in systematic pathways, which are also described as tracts. So the spinal cord is adjacent to and below the medulla, which is the lowest part of the brain, and the top region of the spinal cord extends down from the medulla all the way to the lower back. Throughout the spinal cord, there is a consistent arrangement of nerves, and the sensory nerve pathways are located toward the posterior of the spinal cord, while the motor nerve pathways run along the lateral and anterior regions of the spinal cord.
Good day everyone, I am Maria Regina Mauricio and I'm a first-year college student of BS Occupational Therapies in University of Perpetual Health System of DALTA. Today, I am going to discuss about the spinal cord together with its importance and function in our body. Moreover, I am going to discuss also what are the roles of PTRP and OTRP in the spinal cord region. And lastly, how could this subject would help me to become a PTRP and OTRP in the near future. First, let's discuss the importance of spinal cord in our body. It is an essential information processing center that helps us to carry electrical nerve signals throughout our body. These nerve signals helps you to feel sensation and move your muscles. The spinal cord is a bundle of 31 important nerves that are collectively encased within the surrounds and supports the large venous channels that carries the blood from the brain toward the heart. Vertebral canal that comprises 33 bones. This fascinating piece of artistry is connected to the brain at the base of your neck and runs all the way to your lower back. It is responsible for the sensory, motor, and autonomic signals between the brain and the rest of our body. Now for the parts of the spinal cord region, we have first the dura mater. When we say dura mater, it is a strong, thick, and dense membrane that surrounds and supports the large venous channels which carries blood from the brain toward the heart. Next is the arachnoid mater. It is a spider web-like appearance. A thin and transparent membrane surrounds the spinal cord like a loosely fitting sock. Next is the pia mater. It is a thin layer that holds tightly like shrink wrap to the surface of your brain and spinal cord. It functions to protect the central nervous system by containing the cerebrospinal fluid. Next is the subarachnoid space. It is a space between your arachnoid mater and pia mater, and it's filled with cerebrospinal fluid. Its function is to house CSF, which cushions the brain and the spinal cord while also providing nutrients and removing waste. Next is the epidural space. It contains fat, veins, arteries, spinal nerve roots, and lymphatics. And its function is to absorb shock, which protects the other contents in the area as well as the dura. Next is the posterior white column, aka the dorsal columns. It refers to the posterior spinal cord, which contains ascending sensory pathways that transmit impulses arising from proprioceptors and cutaneous receptors. Next is the lateral white column. It is the white matter on either side of the spinal cord between the posterior horn and the axons of the anterior horn neurons. Include axons that travel from the cerebral cortex to contact spinal motor neurons. Next is the anterior white column. It refers to the large bundle of fibers located between the anterior median fissure of the spinal cord and the anterolateral sulcus of the spinal cord. Next is one of the divisions of the gray matter of the spinal cord. It is called posterior gray horn that contains interneurons that make connection within the spinal cord as well as the neurons that enter ascending sensory pathways, and it contains substantia gelatinosa. For the purpose of occupational therapies for the patient who has a lesion or problem in their spinal cord, it assesses the spinal cord injury to help patients deal with their physical, mental, and medical conditions. For someone who has a trouble moving around, therapy can involve teaching them to dress or clean oneself. It may also entail locating solutions such as the ideal wheelchair of a variety of assistive technologies to make life easier for them. It's crucial that occupational therapies is included in the rehabilitation and recovery process as soon as possible, especially when it comes to spinal cord injuries. These services are essential and beneficial in helping someone recover from a serious spine injury and enhance their quality of life. How could this subject would help me to be an OTRP in the near future? For me, studying neuroanatomy, it is a very significant because it has clinical correlation with determining the patient's neurological manifestations. When we say neuroanatomy, it is the study of the relationship between the structure and function in the nervous system. And it would help me as an OTRP because it gives a fuller understanding about the complex multi-system involvement in the brain, in reflex integration, movement, learning, and daily functioning that will be given to physical and occupational therapies by the end of this course.
Hello, My name is Joshua Richard C. Tan, and I am studying BSOT at the University of Perpetual Health. I will be briefly discussing some different parts of the spinal cord, as well as how the parts of the spinal cord would help us with our roles and responsibilities as a physical therapist and occupational therapist, and then how the subject of neuroanatomy would help me in the future. So, a brief discussion of the different parts of the spinal cord. Here we have a diagram here. So you can see this is the parts of the spinal cord, and what we'll be discussing real quick is the lateral gray horn, anterior gray horn. Lateral gray horn, anterior gray horn, posterior median sulcus, anterior median sulcus, central canal, anterior root, posterior root, the spinal nerve, and of course the dorsal root ganglion. So how would these parts of the spinal cord help us? Well, they send nerves, signals, all that to connect to different parts of the body. They send sensory information, motor information, and it helps with body functioning. So for example, there are nerves sending throughout my body that go in with doing a movement. So they're nerve shooting in and out from the brain to the specific limb needed for movement. So for our roles and responsibilities as a PT and OT, we would be helping the patient with the spinal cord injuries, sensory dysfunction, motor dysfunctions, impairments, impingements, paralysis of lower limbs and upper limbs. And what we do is we go in, we'd help rehabilitate you. We'd either go with helping improve blood flow, preserving nerve function, reduce inflammation if there is. For patients who have paralysis, we'll help you function in activities of daily living with paralysis with different devices to help assist you. So how would this subject help me in the future? Well, for neuroanatomy, it helps you know parts of the brain, know different brain functions, which part does what part does what. For example, if we need to know what part controls or the primary motor cortex of the brain, we would know that's the Brodmann area 4. And we know that if there's something wrong with the motor function, there's probably something wrong with that section of the brain. And this truly helps us to dive deeper in to help understand how our body works, how our body sends signals to each part, how as like cogs in machine, that we see that our body is pretty complex, and it's all works to help benefit us.